Hi, my name is Violet Philip. It's my pleasure to welcome you to my video presentation, Food Safety Issues in the Context of Environmental Policy and Action, Children's Environmental Health. The World Health Organization estimates that on 1.5 billion cases of diarrhea annually, excluding China, 30 to 70% are food-related, resulting in 8.8 million deaths annually, mostly children around 5 years old. It's clear that most of morbidity affects children. The amount of food that children consume per kilogram of body weight is higher than that of an adult because children are not only they need to maintain homeostasis as adults do, but they are growing. If the food or liquid contains a contaminant, children may receive more of it relatively to their size than adults. In addition, children consume different types of food. The diet of many newborn babies is exclusively breast milk. The diet of children usually contains more milk products in certain fruits and vegetables than the typical adult diet. The agents responsible for foodborne diseases include viruses and bacteria, and also a wide range of chemicals, including toxins, pesticides, and also POPs, which stands for persistent organic pollutants, including heavy metals, food additives, and any other chemical that may enter the food. The adverse health effects of foodborne pathogens or foodborne diseases range from milk, gastroenteritis, including diarrhea and vomiting, to life-threatening neurological, renal, or hepatic syndromes, congenital anomalies, and cancer. The risks posed by the presence of microorganisms and chemicals in the food supply are of concern worldwide. Breast milk also may be a source of viral infection in nursing infants. Yes, breast milk can be a source of viral infection in nursing infants whose mothers have acquired HIV, for example. Mother-to-child transmission of HIV can occur in utero, at delivery, or even after birth through breastfeeding, or any other incident that might happen. According to CDC, in drug resistance, salmonellosis is one of the most common and widely distributed foodborne diseases. It constitutes a major public health burden and represents a significant cost in many countries. Millions of human cases are reported worldwide every year, and the disease results in thousands of deaths. Salmonellosis results from consuming food contaminated by salmonella. Infected persons develop diarrhea, fever, abdominal cramp between 12 to 72 hours after eating the contaminated food. But for children, it's more traumatic. In vulnerable groups, such as the young infants or very, very small children, infection may spread beyond the intestine to the bloodstream and cause a more severe systemic disease. More severe disease. As the rate of multi-drug resistant strain increase, there are increasing difficulties in finding effective antimicrobials, especially for the treatment of infants and very small children. According to EPA, more than 83,000 industrial chemicals are currently produced or imported in the United States. Thousands of chemicals are ubiquitous in our environment worldwide. Traces of hundreds of chemicals are found in all human and animals. Every day, children are exposed to a mix of chemicals, most of them untested for their effects on developing systems. Many of these chemicals are readily passed across the placenta to fetus, to the infant via breast milk, or via toys and other children's products. Many of these chemicals are also ingested in food and water and through the lungs by respiration of contaminated air. So now, we have heard about environmental policy action, but listen, in the past, all this environmental policy action was taken in regard of health of the male health, the men, adults, but little have been done for children, to protect children. And according to the National Academy of Science, NAS, which investigated this question to know it's the approaches we have seen so far have been taking children into account, and the results, the findings, the answer was just no. They did not take children into account in those policies in the past. So, what it is, but I'm glad also to know that in recognition of the fact that children are often differentially impacted by environmental contaminants, the Children's Environmental Health Program was established in California Environmental Protection Agency, California EPA, by the Children's Environmental Health Protection Act in Chapter 731, Statute of 1999. This program is responsible for ensuring that California EPA's existing expertise and programs specifically protect children's health in California. So the Children's Environmental Health Program serves as a resource for California EPA and the state of California to perform outreach and education for the medical and public health community as well as the general public, and coordinate with the California EPA boards and departments to promote policies and efforts to protect children. So what we can say is that some steps have been taken. We have some programs in place. We have seen them. We have heard about them. We have read about them. And frankly, they have helped, like California EPA, BOs, they have helped reduce exposures to environmental chemicals. They have helped to reduce exposures to, as I said, the environmental chemicals to enhance public health. But I acknowledge and say that more can be done. We can do more. They can do more. And mostly again because viruses and bacteria, or even heavy metals or stuff, contaminants, they are increasingly everywhere. So public health professionals must be vigilant. They must be vigilant because specifically viruses and bacteria, sometimes they evolve. They give birth to, they produce diverse more resistant types of themselves, or bacteria, or the viruses, or the bacteria, or the viruses. And these things are resistant to antibiotics and other treatment we have available. So we need to always study, find ways to reduce, treat, and make things better for our children, because they are defenseless. They are defenseless. They are more vulnerable. They are defenseless. It's our responsibility to look, to find ways to protect them more and more, and to defend them more and more, and to reduce all these exposures, whether it's ingestion or other stuff. But food contaminants are a very problem and constitute a burden for us. So we need to. So, see you next. Bye.